problem. I'm a little unique in how I conduct my assessments because I like to start off with a parent interview, and a lot of parents aren't used to that. They expect like the first session to be with the child or whatever the case may be, but I like to get all the background information I can without the child present, because a lot of times for a child to hear all the things that a parent truly has to say about the behavioral concerns, I find that if the child can hear that, sometimes that's already that can impact an already fragile self-esteem. So I like to have just an open session with the parents where we can openly communicate about what truly is going on, what their concerns are, get that background information, and then come up with a plan of how to proceed with the assessment. And I provide parents in that session education about the assessment process. I never make a diagnosis without an assessment, and my assessments involve objective, normative assessment pieces. So I don't just observe their child for 15 minutes and make a diagnosis. What I'm doing is I'm giving multiple tests and measures that have been normed and standardized. And so with the cases of an autism assessment, I'm giving specific autism-related tools. And the big one a lot of people know about that I also have received additional training in is the ADOS, and that's the Autism Diagnostic Observation Schedule. And it's one of the most common tools used to assist in diagnosing autism spectrum disorders. And so I let the parents know I'm going to most likely do an ADOS with your child. I'm going to obtain a measure of cognitive functioning so we can see where they're at and what they're going to understand moving forward. I like to get a measure of attention because as you're probably familiar with, kids on the spectrum don't always attend very well. And so I like to get a measure of attention, and then just adaptive functioning so I can see where they are developmentally. And I try to let parents know with the process of assessment, while yes, I'm being as objective as possible, this is just what your child looks like on the day I happen to capture the data, and that children are always changing. So it's important to get this data at least yearly in order to update the progress that they've made. But what I like to tell parents is, after the assessment is done, you'll have a good snapshot of where your child is right this moment, as far as what symptoms they're exhibiting, what diagnostic criteria do they meet, but in addition to that, where are they developmentally compared with their same age peers? And what are the areas that we can work on therapeutically here at the clinic with ABA or with, individual behavioral intervention, which I provide. What can parents do at home? What books can they read? What resources are available to them? What apps or programs can they use? And so I end my assessments with a feedback session where we sit down and we talk about all of those things. And I'll even ask, so what are your school concerns? And I'll include recommendations for school. And if we need to set up a school meeting to form an IEP or a 504, I'll guide them through that process and say, hey, look, if you need someone to go with you, I'll go with you, because I feel like it's important for parents to have an advocate with them as well. And what's great about some of the military families I work with is that service is offered on post, but in addition, I'll show up too, or like an ABA therapist will show up, and the more people that are on the child's side, the better the outcome is, because then it truly is a team approach, not just the school team approach, but the entire team that's working with the kid is coming up with a plan that is working at home, at school, and in the clinic. And so I'll even offer that additional piece to families. Like, you need help at the school, I'll come with you to the school. Now, I can't guarantee they'll listen, but I'm definitely going to try and help you advocate as best as you can for your child. And so there are some of the school psychologists that I work with very well, some of the schools in the area that I have been able to work with very well in the past, and welcome my input, which is kind of nice because after being in the Augusta area for about 5 years now, you would hope that when you run into the same schools that they would take into consideration what you have to say. And I do find that happening. And plus, it just gives parents peace of mind, because when you start talking IEP goals, they're like, what? And I'm like, okay, this is where I can help. And then I'm able to explain to parents afterward, how that process goes and what that goal means in parent speak. It's several different schools all throughout the area. And I don't want to miss a school, so I don't feel comfortable just listing, because I don't want to miss a school by accident. But both Columbia and Richmond County, I've had pretty good success with at least them getting familiar with me and my process, and will allow me to attend meetings and are at least open to what I have to say.
And that goes a long way in that setting.
It does.
Just because you have that long-standing relationship. So.
And additionally, I'll often, if they're exhibiting disruptive behaviors in the classroom, I like to go into the classroom. And so a lot of the schools, again, while initially are like, what, you want to come see our classroom? Because they're not used to that being part of the process. They've actually gotten used to just knowing that that's the way that I conduct my evaluations, because I can't talk about school behaviors if I don't see the school behavior. And so then it's just another piece. So they're getting that data from me, and then they're getting that data from the school psychologist who's also doing the same thing. And so now you've just got multiple data points, and we all know we can come up with the better plan the more data that we have.
Exactly, definitely.